Hello world, we are Dawn and Seb, and we are from Performance Place Sports Care in Huntington Beach, and we are going over right-sided low back pain while driving, what could be causing it, and what to do for it.
Yep, and who are we again? Who do the locals think we are?
Locally world famous.
We're locally world famous chiropractors again, just like your favorite sandwich shop. Mr. Pickle, have you been there?
No.
You're not a local. So, yeah, they have like this crunchy crust.
On the pickle?
No, it's Mr. Pickle Sandwich Shop.
Oh.
So.
I was like, that sounds pretty good. I like pickles.
Well, the crust, I think pickles are good. But when the crust is like, I think in the definitive crunch on it, like it's like the carrot, it's not soggy. Okay, so right-sided lower back pain when driving. This is a very unique situation, so I think it's probably important to talk about. It's very different than left-sided lower back pain when driving, except if you're in a different country. So it's what foot addresses the pedal, the accelerator, and probably the gas or the brake too.
You ever tried to switch feet?
No, but I know someone who they had right-sided back pain when driving, and they started switching feet.
It's so weird. I actually challenge myself to do it all the time. I don't know why. It's just fun.
I'm not gonna drive by you. So the first thing is, let's go ahead and the area that we're talking about is just kind of around here. And sometimes people have leg pain or hamstring tightness, hip flexor tightness, all associated with it. But here, the thing is that we usually see in the office is this is just a nerve tension problem, what we call radiculopathy. It's an S1 radiculopathy. I know, big word. You can Google it if you want to. Don't read all the articles because they'll freak you out. Just go with what we're talking about in this video. But it's a very unique situation where bending forward seems very menacing to these people, but I don't think they realize of what situation they're putting themselves in when they're driving and how close it is to a very provocative test. Mm-hmm. So let's do the test.
Cool.
Okay. And so we'll slide this back. Do you want me to be the subject or the doc?
Doesn't matter to me.
Okay. I'll be the subject. You take me through the test.
All right. So, what we're going to have you do is sit in the chair like so.
Okay.
And go
a tad down.
Hands behind your back for me. Okay. Go. So we're going to go in steps, you guys. You're focusing on that low back pain. We're seeing if any of this provokes it. So chin to chest. Good. Slouch into a poopy posture. How does that feel? Some people might have it right here. Some people we can progress a little bit further. Stay where you were. Good. Now put your foot out for me like you were going to press on a gas pedal. Does that bring on your pain?
Yeah.
Does looking up help at all?
Yeah, I can see the road now.
Okay. Go back down. How about if you point your toe like you're pressing on the gas pedal? Same, better, or worse?
That's okay.
Okay. So what we're doing here, you guys, is this looks very similar to sometimes when we're in that slouched driving position, okay? We're putting that nerve on tension, and if it's reproducing your pain at home while doing this, then this probably is what's causing your pain.
Yeah. Yeah, so it's if you imagine a nerve, where's that little ropey thing? So if you imagine a nerve, and I'll do it on my left side here, there's a spinal cord that goes all the way from the head, so you see the rope, okay? And it goes into the hip, and it goes down the leg, and it goes out into the foot. You see it okay?
Yeah, it looks good.
And imagine all the way the foot right there, and every time I bring the foot back, because it goes underneath it, I'll just grab it here, okay? Every time I go like this, it just kind of yanks from the top, and when you let the head go, it kind of helps. So sometimes what a lot of people observe too with this is like they're like it really hurts to bend forward. If you think about where the foot is in this position too, the foot's flat on the ground, the knees are straight, and then you're bending. It's the same test. It's the same exact test, except when you bend your knees, all of a sudden you have all the range in the world, and because you're taking the nerve off tension. So what's something maybe people can do about this then?
Well, one thing while you're driving, if it's mainly while you're driving and you're noticing it and you want to know what to do about it, I just tell people you don't necessarily have to buy those like back rolls or lumbar supports or anything of that sort. Like I just bring like a hoodie or like a sweater with me and leave it in my passenger seat. I roll it up and put it behind me, and it'll put you in a more upright position, which could really help and prevent you. Cars nowadays, the seats they're comfy, but they really put you in this rounded position, which could really, really hurt you. So putting some support behind the back can help.
Yeah. I take it a different direction a little bit. Is I let the seat do its thing, but I move the seat forward, bringing the pedal closer to me. And so essentially, if you see my foot, imagine the seat's coming closer, the pedal comes closer. So now what happens is I allow the nerve to go off of tension because the knee's bent. Mm-hmm. But if you're right here doing this thing, then it's going to be at tension. So mm-hmm. if you bring the seat closer, or do what Don said, then it might be the super easiest win in the book. It won't solve all your problems, but it'll certainly make it more comfortable to drive on the trip that you want to go on.
Yeah, it can help prevent re-injury while you're driving, especially if you spend a lot of time in your car. But we want to resolve this. That's not the only thing that you need to do. That just can kind of help. That could be a part of the puzzle, but there's things that we need to do, like exercises and finding out what's causing it in the first place and finding you a first aid to help reduce it in the meantime. Do we want to go over that at all?
So we have other videos. I think we can. There's other videos that we've covered first aids for lower back pain. I don't think we've done. We'll do one for radiculopathy. So just type in rad, I, low, no W.
Kilo.
Is it? So anyway, just go on the channel and you probably type up leg pain. It'll probably show up too. But go on the corners, and so we'll go up. It'll take you to the channel. Just subscribe to, and you'll get it right when it comes out. We're not going to try to make this video too long, but because we can go on and on about this topic. But if you're looking just to get help and just get over this thing as soon as you can just come in. We're in Huntington Beach. We'd love to help you out. We're very good at what we do, and we specialize into the low back, the hip, and stuff like out into the leg. We can do the other spots too, but really our bread and butter is going to be into that area right in here and down the leg. What if they're not here?
Guys, we have tons and tons and tons and tons of options for virtual.
An exhausting amount,
I always say that. We have, especially through the quarantine time, we've really figured out how to meet people where they're at. Different price points are boundaries, and if location is a boundary, we have tons of ways that we can help you online as well. So if you would like to know more about those ways and what to do and have us help guide you, just send us an email at info@p2sportscare.com. We would love to chat with you and help you out with that. I don't know if I have one. Stretches. I have workouts that have stretches. We did the laying on the back one already, right? We've done that in a different video. Instead of stretching like this, stretch laying on your back.
Oh yeah, we can do it again.
Okay. All right, whatever.
Consider this as a real hamstring. We'll qualify like not hamstrings. We can talk about it not being a hamstring, but if it really is a hamstring, here's what we can do. Like PIR and things like that, contract, relax.
Okay. Oh, sorry. I'm used to you starting. Hey guys, so we are Don and Seb, and we are from Performance Place Sports Care in Huntington Beach, and we also are locally world famous.
We are locally world famous, just like Subculture. Have you been there?
I have not.
You're not a local. You know how I know you're not a local? You haven't been to Subculture. So we're going to go over the top 3 stretches for hamstring tightness today. Consider that there is a lot of reasons why your hamstring tightness is not from your hamstring. And so there's actually a higher probability it's not from your hamstring. And we have covered various videos on this already. So go to the channel, subscribe, and type up probably low back pain or sciatica. And those would be good videos to go from. Because some of the stuff we're going to do here would not apply to those cases. But if you really do have a tight hamstring because it's a tight hamstring, we'll show you the best stretches we can.
Cool.
Okay, so you want to go first or second?
Second.
Okay, I'm going to start. Go and line your back, Don. So if we want to stretch the hamstring, one of the easiest ways is I'm going to act like I'm a wall because I don't think you guys want to have to get a buddy for this. But a contract relax stretch is a really nice one, and so let's go ahead and put that one down. And so she has her back flat on the ground, and so this is at least safe on the spine. It wouldn't be safe if you had sciatica or tingling into the foot or the side of the shin or into the outer thigh. If that is the case, again, go to that sciatica video. And so I'm going to act like I'm a wall. Bend that. You're not the most flexible in the world, are you?
I didn't know what you were doing. Okay. And no, I'm not.
Okay. And so what she's going to do, if I'm a wall right here, she's not going to be able to push me over, so we're not going to go this way at all. And so she's going to kind of put her butt up against the wall here. So her knee, or sorry, her heel and her buttocks is in the same plane. And all she's going to do is try to bring the heel to the ceiling. Good. And down. And up. And down. Good. So she's not pushing me away at all. I'm just kind of helping as the wall. And she do this about 5 times. Push, 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 push.
Am I holding? Am I repping? What
Yeah.
am I doing?
I'd push, 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 and relax. Push, 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 and relax. You're going to notice that you're going to be able to get a little further each time. But I like contract, relax. I'm not super specific on times. I know you can say 10 on, 5 off, blah, blah, blah. I personally don't care that much. It's just creating tension through the movement. And if the range of motion changes, that's all I want to see.
I like it.
Okay.
That's a cool one. Another one we can do is most of the time people are stretching their hamstrings like this or sitting on the ground like that. And the one thing that is dangerous about that is if we don't know what exactly is causing our tight hamstrings and we haven't necessarily ruled out the low back, we are putting rounding into our low back, and that could be driving the symptoms even more. So let's take the low back component out of it and just allow you to stretch the hamstrings. So Seb, you go on your back. And you can grab a band, like so. So you can do it yourself. Put it around your foot, extend, and pull. And this way, we're just holding and breathing, okay? And then relaxing as well. And it's taking the low back component out of it. He's nice and stable here. He can activate his belly wall, so push into me, stiffen, like I'm gonna punch you. Good. And sometimes when you turn on that belly wall like that, like I'm gonna punch you here, he stiffens and he pulls, this gets a little bit further. So that's what I really like.
You stole mine. So now I gotta think of another. Okay. So why don't you go ahead and go in a long sit position.
Okay, like this.
Here we go. Yeah, you stole mine. So there, I'll have to pull one out of the archives. So again, as long as the low back and the nerves are clear, we can do something which is very obscure, but sometimes the hamstrings are tight because of the nerves sliding through or not sliding well. And so we're going to put her legs up, or her feet, her really white shoes, up against a wall so they can't move anywhere. And so she's going to start by creeping in with the body and bring the chin down, and then creep in with the body until she feels like she's at tension. Okay? It shouldn't create back pain. Now she's going to go head up, head down, head up, head down. And if you do this, you're going to feel, keep moving, so you're going to feel that the hamstrings are going to kind of get tight and then untight. And so you're wondering probably, what the hell? Like, why is my hamstring attached to my head? It's not. The nerves are. But you don't want to be in a tensioned position too long. So we're basically just kind of pulsing through it, and we're just letting things slide through the hamstrings. And I think if I recall, the study was that all they did was this over conventional hamstring stretching, and this beat them hands down. Okay?
That's a cool one.
So those are 3 things.
Let's do a little bonus.
A bonus? I don't have a bonus.
I have a bonus.
Okay.
Okay.
A 4th.
So all we're gonna do, I remember in school one time we learned, go down, touch your toes, see how far you can go. Take note of that baseline. Let's do a hard style plank, and let's see if you get a little bit further. So I'm gonna show you a hard style plank really quick on Seb, but first I want you guys to take a baseline of how far down you could go before you feel your pain, or just, oh yeah, I can come to right about here, and that's it. So then I'm gonna put Seb on the table here, and he's going to look through the tunnel, Seb. So what that means is he's looking through his knees here. He comes up into a plank position, but planking from the knees instead of the feet. He's gonna push up through here, through his elbows. He's gonna squeeze his butt cheeks together really, really hard, almost like he's embarrassed that I can see how hard he's squeezing his butt cheeks. That turns his belly wall on. He's gonna bring his elbows and his knees close together without actually moving, just creating tension. Hold, 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 hold. And then go ahead and relax. For you guys at home, I want you to hold that for as long as you possibly can. You should only feel the belly working, and then retest and see if that helps with some of your hamstring tightness. I noticed that made a huge difference for me when I learned that.
I got another one I should say for another video. Then.
Okay.
No, we should do it with this video. There's one more then.
You want to? Cool.
Yeah, you just
bonus.
reminded me of something. So bonus. Okay, so let's get rid of the table. Let's get rid of the table for this one. And let's see if, I don't know if this will really work on Don, but we should try it for real.
Okay.
Okay. And so go ahead and scooch back a tad so we can all see how far you can touch your toes.
Okay.
Okay. So just note where she's at. This doesn't work with everybody, but it's really, wait a minute. Okay, good. Go ahead and turn to the side so we can see. Okay, so she's good. Go ahead and come back up. So it doesn't work on everybody, so just note that this might work on you, and if it does, then go ahead and put a comment below. So we're going to put this between your knees. Okay. Get a little squatty. Just crush it. Hard as you can. Break it. Break it. Break it. Harder. 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 You guys at home can put your fist between your knees if you want. It's a little bony. This is why this is nice. Come on, break it. Break it. Break it. Harder. Harder. Come on. Come on. Harder. I want 30 seconds. Hard. Hard. More. 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 Squeeze. Break it. It's full of gold nuggets. Okay? It's full of buried treasure and gems and rubies. I know you like rubies. Come on. Harder. 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 More. 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 Good. Go ahead and relax. Okay. Let's see what happens here.
That's pretty cool.
So she got it like that much more.
I honestly didn't even know he was going to do that one too. That was really cool.
Yeah. So there's a little bit of trickery involved, and so I guess in this case your hamstrings aren't the problem; it's other things. So this kind of relates to the nervous system being on guard more so than just the hamstrings. But there's a lot of easy hacks you can do. So if you guys are looking for help with this, we are in Huntington Beach. We are locally world famous. It doesn't say it outside, but it should. Maybe the new sign will.
Okay.
And what if they're not around here, Dawn?
Guys, we have an exhaustive amount of options for people who are at home and not in the area maybe, or uncomfortable with leaving the home right now. Virtual options, online options, whatever it may be. You just have to shoot us an email, info@p2sportscare.com. We'd love to chat with you, talk about your symptoms, and see if we think that you would work best for some of the online options that we have for you.
All right, see you soon.
Cool.